Hello, I'm Dr. Brad Holmberg. I'm founder of InvisalignDoctors.com, and I'm excited to announce that I've created a new video series, and I'm calling it the ClinCheck Roadmap, the key to predictable treatment plans. I've set up hundreds of Invisalign treatment plans, and the process I use is very repetitive. I basically do the same thing for every treatment plan. So I'm going to show you that in this video series. I'm going to take a fairly complicated case, and each week I'm going to go through one of these steps. So there's 5 steps that I use to set up a ClinCheck. The first thing I do is I always work in the posterior first. This is where I set the dental arches. I'll always go for the upper arch first. I'll set the proper shape, the proper form. I'll set it up for function and for aesthetics. And then I go down and coordinate the lower arch with the upper arch. I use the 3D controls to do all this. I also check and adjust tooth movements. I simplify them. I try to make the movements as low as possible, especially movements that change the position of the root apices of the teeth. Then I set the occlusion. In deep bite cases, I'll usually go for heavy posterior occlusal contacts. In anterior open bite cases, I'll usually want light posterior contacts. After I'm finished working in the posterior area, I go to the upper anterior teeth. I check the patient's smile photo and then I decide where the level of the incisal plane should be. So for example, in patients with gummy smiles, I'm usually going to want to intrude the upper anterior teeth. Deep bite cases usually require anterior intrusion. Open bite cases usually require extrusion. I look at the buccal lingual inclination. I kind of look from the side a little bit. And if needed, I'll adjust that buccal lingual inclination by adding or reducing torque. If additional attachments are needed, I'll usually place them at the time I set tooth positions. And I always check tooth movement values and I try to simplify them as much as possible. So once I finish with the upper teeth, I just go down to the lower anterior teeth and I essentially do the same thing. I check the level of the lower incisal plane. In deep bite cases, they'll usually require anterior intrusion, so I make sure that there's enough intrusion. Open bite cases often will require extrusion. I check the buccal lingual inclination, just like I do with the upper anterior teeth, and if needed, I'll adjust the torque. If additional attachments are needed, then I'll usually add them while I set the tooth positions. And I also check and simplify tooth movements as much as possible. The next step is to create the proper overjet. In most cases, require some excess overjet in ClinCheck, especially for the initial treatment plan or the treatment plan for the initial set of aligners. If you don't do this, there's a pretty good chance you may end up with premature anterior contacts at the end, and you don't want to see that, okay? So I prefer to create excess overjet in my cases. This means a slightly anterior open bite, cuspid to cuspid. Now to get this, I may add IPR, or in some cases I may leave space distal to the upper cuspid teeth. Again, it's important to create this in the initial set of aligners. So after now the anterior teeth are all aligned, the incisal planes are all set, the posterior occlusion and the arches are set and everything. Then I just decide on some other features. So for example, bite ramps. I'll usually add bite ramps with teeth 8 and 9 in most cases. The exception is open bite cases or class 2 cases where the overjet is so excessive that the patient would bite behind the bite ramps. There's sometimes I want to add some more attachments. Attachments would be maybe posterior teeth, especially premolar teeth that don't have any attachments up to this point. I'll usually add what I call retention, optimized retention um, attachments, or horizontal beveled incisal attachments. And those provide anchorage and they help the aligners to stay down really well while you're moving the anterior teeth. I'll just recheck movements, go over and check out things. Sometimes when I move the anterior teeth, there may be a few teeth in the posterior that need a little bit of adjusting. There might be a high occlusal contact that you have to adjust. Do I need cutouts for any kind of elastics? I'll often add passive aligners at the end. I prefer to have 2 aligners without attachments and without tooth movements at the end of my treatment plans. And then I can use those passive aligners to hold tooth positions while I'm waiting for either additional aligners or for retainers. Do I need overcorrection aligners? The overcorrection C-chain aligners will help to reduce spacing and tighten up anterior interproximal contacts at the end. Is the IPR staging okay? So I'll usually run live update, and after live update is run, I'll just recheck that staging. And if it isn't okay, then I'll submit some written instructions. So that's how I go through every case. And we're going to take a case here, and for about the next 5 weeks, I'm just going to go through the whole case step by step. Each week, I'll work on one of these steps. So next time, for next week, I'll work on setting the arches of this case. So here's the case that we're going to use for this series. This is Rachel. She's about 25 years old. I'm not, you can see her smile looks pretty good here. There's no problem with, you can maybe intrude a little bit if you needed. Here's her images here. Notice that there's quite a bit of recession around the lower cuspid teeth. So I'm going to turn off the photos and let's take a look at this case. So she's got pretty good arches to begin with. There's a little rotation, nice arch form, mild crowding. This treatment plan has 49 aligners. This is the initial treatment plan that came back for this case. You can see, there's a lot of expansion. Look at the arches. Look at the posterior movements. You probably don't need that. Let's look at the lower. Notice the lower anterior teeth coming out really far. So there's a lot of crowding on the lower. That will be the challenge with this case. She's got a deep bite. It's kind of like a cross bite over here. So this is a more complicated case. And this case cannot be like 14 aligners. It's going to have to be 20 some aligners. But what we're going to do over the next series is I'm going to simplify this treatment plan or change it into a predictable one, starting with the arches first for next week. Okay, that's it.